So today I want to talk a little bit about the benefits of vitamin D for dealing with chronic pain. The majority of people today have a vitamin D deficiency. This is due to the lack of nutrient intake. Unfortunately, not a lot of foods contain vitamin D and not a lot of foods that people eat commonly. Lack of sun, years ago we were outside farming and hunting all day. Now most of us work in offices. Or sometimes people have a rare disease that limits or impairs their absorption to vitamin D. A lack of vitamin D can result in some pretty severe issues such as rickets, cancer, autoimmune diseases, hypertension. It can result in you getting more infectious diseases, and it can also lead to depression. On top of that, a vitamin D deficiency exacerbates musculoskeletal pain, fibromyalgia, osteoporosis, and even increases your risk of fractures as an adult. The daily recommended dose for vitamin D does vary for different studies, but when we're talking specifically to chronic pain, it has been noted that most people with chronic pain, especially fibromyalgia, do have a vitamin D deficiency. Typically 43% of them do, according to most studies. That's an average. And on top of that, they needed more than the recommended daily value of vitamin D intake. So for example, I bought this vitamin D supplement at Trader Joe's, and they're saying I should take one soft gel a day, which is 1,000 IUs, which should be 250% of your vitamin D daily intake, which is above the recommended value, obviously. But when they did studies of different levels of vitamin D intake with people with chronic pain or fibromyalgia, they realized that they actually needed an even higher dose, somewhere between 2,000 and 4,000 IUs a day. So do be careful. Vitamin D in large intakes can be toxic. So definitely it's not a bad idea to go have your levels actually tested by your doctor before you start supplementing. You may notice online some research about doing a massive loading dose. Again, that's something that you should be working specifically with your doctor and or a certified nutritionalist to determine if that is the appropriate way to deal with adding vitamin D supplements into your diet. But I personally just did it really gradually. So I started with one capsule a day for about a week, and I did see a difference in pain, and then I decided to up to 2 a day, and again, some more improvement, but still not quite where I wanted to be. So I'm going to start taking 3,000 IUs daily and see how that goes. Some people do take even more than that, but again, because high levels of vitamin D aren't necessarily the safest thing, if you're going to go above the 4,000 IU units a day, which the government has deemed safe for us, then I definitely would make sure that you're dealing with a doctor. But if you are suffering from chronic pain on a daily basis, no matter what the original cause is, you should definitely consider adding a vitamin D supplement to your diet. I hope you have a great day and that this helps you live a little bit more pain-free.